So Julie is 54 years of age and has a painful right shoulder that has been painful for
5 years.
5 years. And how many injections have you had into the shoulder?
Approximately 5 or 6.
And do they help? Each one helps temporarily?
Yes, short. There is a short improvement, but then the pain just comes back.
Okay. And it keeps you awake at night?
It does, yeah.
And it stops you doing what sort of things?
Reaching, lifting, moving forward. For example, to shake somebody's hand, to reach for my keyboard at work. Those sorts of things.
So we examine the shoulder. The patient sits in front of a mirror so I can see the patient's face, and I can see the anterior, the front of the shoulder and the side of the shoulder and the back of the shoulder. Just show me you yourself. Just lift your arm straight up in the air as high as it'll go, and just till it comfortably goes. That's it.
That's
Starts
it.
hurting there and down. That's good. And can you raise your arm up behind your back?
That's as far.
Okay, that's fine. Just let it go really loose, and if I cause you any pain, let me know. So the arm is rotating quite normally, and as I lift the arm out to the side, Julie will wince there and she'll want me to stop. And that's bringing the torn tendon in contact with the undersurface of the acromion, which is this bone just here. And there's a few other tests that we do, which essentially cause pain if the tendon is torn, such as is here. Julia's had pain, she's had injections, the shoulder hasn't settled down. She has failed what we call a non-operative treatment program. We've done some investigations, including an MRI scan, which clearly shows a tear of the rotator cuff tendon. So Julia, the problem that you have is that your tendon is torn, and instead of being firmly attached to the top of the humerus, to the top of the arm bone, you've got these torn edges which are floating free at the top of the shoulder and catching on the undersurface of the shoulder blade. So the surgery that you need, it's called a rotator cuff repair. We do the surgery arthroscopically, which means it's a keyhole surgery. And the operation involves reattaching this torn tendon back to the bone. In a sling for 3 or 4 weeks, but you'll be able to commence writing and typing and light office work after 2 to 3 weeks.
Okay.
They're the brachial plexus there. There's the nerves. That's the end of the needle. That's the fascial layer. And here's all the local anaesthetic that's spread around. In a moment, Dr. Biggs is going to get you to lift your arm up and you won't have any pain in it.
Okay.
Good block that one. That'll be good. How's that feel?
Oh, wow.
Is that better?
Yeah, that's great.
No pain?
Oh, yeah.
Yeah.
So how are you feeling after your operation, Julie?
Okay, thank you.
Still no pain in the shoulder?
No.
We're going to go through some handouts here, as well as teaching you how to get the sling on and off, and some exercises to do while you're at home.
Okay.
Okay?
Yeah.
So this handout here is from Dr. Bix. So it explains that he's done the rotator cuff repair, which is what we thought he would do this morning to fix that tear up. So the sling, you need to wear that for 4 weeks. And it's important that you keep the muscles around your shoulder loose and relaxed during this time, and you don't move your shoulder.
Okay.
Keeping them relaxed and loose will help the repair, and it will also decrease your pain. You can use your hand for light activities like writing and typing at a keyboard, as long as it's just your hands moving and there's nothing up to the side and nothing up into the air. Okay, so just in front of you typing and writing.
Okay.
The second handout is about icing. It's really important to ice your shoulder to reduce your pain and also to reduce your swelling. Okay? So wait till your sensation returns, then start the icing tomorrow. 15 to 20 minutes, and you can repeat this 4 or 5 times during the day, so every couple of hours, to help control the pain and control the swelling.
Okay, then.
Okay, so this is for you to take home as a reminder.
Good, thank you.
The last handout I have for you is some pictures about how the sling should look as a reminder for when you go home. And that should feel like it's supporting your arm. You shouldn't have to support the weight of your arm. The sling should take all of the weight. Okay. You want it with fingertips in your belly button line. Okay. And if I take the pillow away, it should feel comfortable, and you should feel like you can support in the sling.
It does.
It does?
Yes.
Beautiful. So the last thing we'll discuss is your exercises. It's really important that we keep your hand, wrist and elbow moving so that they don't get stiff during the time you're in the sling. Plus that exercise your family is going to do for your shoulder, so that doesn't get stiff either.
And for the back one, someone will be able to, maybe your husband can do it for you. Okay.
We are 8 weeks following surgery, and we have a look, and the wounds have healed quite well. And at this stage, with a smile on your face, we'll see how high you can lift your arms straight up in the air. That's it. Good. And down. Okay, thumbs up. Julie now is 4 months down the track. Just lift your arms straight up. Oh, that's good. With a smile on your face, and down. And now out to the side. And down. Just a little thumbs up with a smile towards the camera.